Hello everyone, I'm Dr. Thameem. I'm here with Dr. Het Shah. He's got fifth rank in the recently conducted INI-CET. So huge congratulations, Het.
Thank you, sir. Thank you.
Do introduce
Thanks a lot.
yourself, your college.
Yeah, so my name is Het Shah, and I did my MBBS from AIMS Delhi. I am currently in my internship. It hasn't got completed yet, and I actually this was my first attempt at a PG entrance examination, and yeah, that was about my basic information about me.
Great. I think phenomenal first attempt, and you have smashed, great record. So I think this current batch of yours in AIMS have really done amazingly well. And notwithstanding, some students outside AIMS, have this feeling that AIMS internship is cool and it's very easy. And I know the truth is different. It's definitely very hectic, and it is long hours of duty. So in spite of that, I think your batch has done well, and many of them are first timers, meaning first entrance they gave and they've got through.
Definitely.
So
This batch has really performed well, and I was expecting a good competition because of the people I knew around me. And definitely, the internship, in terms of internship, actually, my timing of my village posting, which is a 3 month posting at Vallabhgarh, was quite bad because August, September, and October I was posted in the village in where I had really had low amount of time to read anything, but I did manage with whatever I could, and I basically knew that beforehand. So I prepared in the 6 months that I got before the village. So I tried to make use of whatever time that was available on hand. Even at least grinding out at least 2 or 3 hours every day, despite the long duties that were there on the in my schedule. So my basic motto was to just at least practice some MCQs and go through something for at least 2 3 hours every day, because I did not want to skip a single day, just getting in touch with the PG material that I was preparing. And so that was how I managed through my village posting. But that was the most hectic part of our internship for sure, and it happened to be just before the examination. So it was a tricky situation, but I just went through it.
great, great.
Yeah.
So, see, those who are listening to this interview definitely want to know how you crack this exam. So, any tips you can give to this regard will be welcome. So, when did you really start thinking about entrance? Which year were you in your UG? And nowadays, we are seeing the trend is keep people who are in undergraduation who are seriously thinking about the entrance exams. And the general plan we advise them is key whatever subjects you have in that year, focus on that, make notes, do MCQs, and that will help you for your current year as well as entrance. How do you think of that plan? I mean, what is your
Well,
suggestion?
I consider my preparation to be more of a traditionalist approach. I never really seriously just focus on the PG entrance as such. My basic funda was to just get my basics right, and so I was focusing on the textbooks throughout my entire undergraduate period. I used to follow one textbook for each subject, and I used to maintain that, and I used to believe that textbook forever. And I really started solving MCQs in my final year only. So in final year, I started solving the MCQs of the clinical subjects, and all the other subjects. I started to look at the previous year questions as well in my final year. So I never really thought about the PG entrance specifically before that time. So I think for serious preparation of a PG entrance examination, if your basics are correct, if you are good in your theory, I think it should be enough for one year should be more than enough for a good preparation of a PG entrance examination. So that is what I had in mind. I wanted to get my basics right, and I wanted to brush up my MCQ solving skills in the internship period. So that is how I went throughout my preparation. And basically, my even in my internship period, the books that I used in my first reading was the same books that I used in my undergraduate period. So I never deviated from the books that I used. I used the same review books and the same textbooks, even though they are lengthy, and because it took me less amount of time to go through it because I had studied them earlier. So I trusted them for my first reading. And in my second and my third readings, I used to go for the individual subject notes of each subject, because I wanted to revise the entire material in a short amount of time. So I at least ensured that I would go through the entire 19 subjects for at least 3 times. So that was how I prepared my entire internship year. So 3 readings of each subject. And in the second and the third readings, I would prefer to go for individual notes because they are concise. And that was how I prepared, and I divided by preparation. And in terms of practice of MCQs, I did not go through the entire MCQs in my internship period. I basically just relied on the tests that were being conducted. So I gave as many tests as possible in terms of grant tests, and in terms of TNDs. So that was how I approached my MCQs in my internship period, because I wanted to get actual experience of an examination in a time bound manner. So that was basically, how I did my MCQ practice along with the revision in the internship period with whatever time I got.
So what percentage of time do you think would be appropriate for doing MCQs, and how much time for theory? How would the ratio would be approximately percentage
So
wise?
I think that definitely every day in the internship period, you should at least have some 20 MCQs solved. So I would never recommend that you skip that you skip a day in terms of MCQ practice. Whatever you can get your hands on in terms of a TND or some grant test or something. So whatever you have a hands on, you should at least solve some MCQs every day, because that helps you to keep in the habit of solving MCQ, which is very important. Because sometimes in the actual examination, even if you don't know the content, even if you don't know the matter, if you are good at solving MCQs, you will get a few questions correct, even which you have no idea about. So I think that is very important. And the most important thing about theory is you should be only focusing on those topics that you find yourself uncomfortable in. So the first reading is a thorough reading. So I used to go through the entire topic in the first reading, and in the second and the third reading, second and the third readings, I used to focus on my weak topics. So I had a list of my weak topics in every subject, and I used to focus more on those topics only. So, for example, if I talking about ophthalmology, I would focus on more on squint. In medicine, I would focus more on the EBG and the electrolyte topics, because I used to be a bit shaky in those topics. So I had a list of those topics which I maintained, and I used to focus more on those in my second and my third revisions, because I think that if your strengths are your strengths, they will not betray you in the actual examination. But if you haven't ironed out the weaknesses, then they will come to haunt you in the actual exams. So I think that is what we need to focus on in the second and the third revisions.
Great. So I always have this feeling that second year is the most important year for entrance preparation. So what books did you read in second year? Like for patho, what book did you read?
So as I said, I always used to follow standard textbooks always. So
So you
pathology, I
read
would read
Robbins?
Robbins. Yeah, I read Robbins. Even in medicine, I read Harrison's. So
Just
I think
one thing over here, to interrupt you. Were you reading hard copy of the book, textbook, or were you using iPad or computer or
in
laptop or
my
something?
time, there was, I mean, the iPad was a recent concept still. I mean, the pencil wala iPad. So I had all the hard copies of the books that I read. So I always enjoy the hard copy of a book, because it actually makes you feel more grounded to the reality, and it actually makes you feel more, as if you are actually doing something. It is easier to track your progress when you are reading a hard copy, and it gives a satisfaction that is not achievable on a PDF.
Great.
So I think, yeah, hard copy is the way to go.
Right. So when you started doing your mock test, that is grant tests, how was your performance in the first few grant tests that you gave? And then until recently, what was your like? How was your scale? How
So
did it
the
go?
the first grand test I gave was back in the last year, before November. So I gave the before the November aims last year. So I got a good a decent rank. I got a single below 100 rank in the first test itself. So after that, I used to give at least one grand test every month. I used to make a habit of giving at least one grand test every month. So I give around 15 to 16 grand tests during my entire preparation, and my ranks were quite steady. I used to stay in the top 100 almost most of the times, but in the mid phase actually had a fall. So I was achieving around 500 to 600 ranks in the mid phase, and then again recent after in the last 3 months I had a gradual pickup. So I started gaining more and more. And in the last test, actually, I got a rank of 5, which is the same as what I got in the actual exam. So it was definitely a kind of a dip, and then again a rise. So it was definitely a good journey in the grand test.
Great. So nowadays we realize that doing internship and doing it sincerely also benefits in your exams, because they are asking questions for people who are working in the hospital, they get advantage. So what postings would you advise your juniors to be a little focused on that will really help for the exams as well?
Well, most certainly, I think the trend is definitely shifting. And as an example, in medicine posting, if you have done some cannulations, if you have done some sampling, and if you've done NG tube insertions, it will definitely help in your actual examination as well. And even in this time, they asked about how to measure the NG tube length. So you have to know that there is the next method of measuring it. So I think in the actual posting, if you have done these procedures, it becomes much more easier, and you don't have to prepare specifically for these things. So I think medicine posting would be the one that has to be gone definitely. And also, fortunately, in my time, I was also posted at Judger for my COVID posting. So I learned a lot during my COVID posting as well, because we learned about the settings of the ventilator, we learned about the oxygen devices. So what is the NRBM, what is this, how much flow can be given. So all these things I learned during my COVID posting, which were definitely helpful in my actual examination as well. So I think the most important thing is to find the correct balance. You have to find the correct balance, that what will be helpful and what will not be helpful. The procedures and the stuff that you learn in the wards is definitely going to help you, and those are things that you can't really read in any book or elsewhere. So the most important thing is to find the balance between doing those things and also finding time to study the theory. And if you do that properly in your internship, then I think it will be a great success formula for a PG examinations.
Great. Great. I think it's been great listening to you. It's really phenomenal. One of the things I think where students lag is I think that they look the presence of mind when they are during internship. They are half the time on their phone, sending WhatsApp to their friends or seeing some YouTube video or something. So I think to a large extent, proper presence of mind wherever they are, whether they are in the hospital, whether they're posting, I think all these things definitely makes a big difference. And I think kudos to you. You have really done well, and it's phenomenal first attempt. Awesome performance. So huge congratulations to you. Any final words of advice
I mean,
to
in
your
terms of
juniors? And
yeah, definitely. In terms of preparation, I would like to say that those students who are in the third or fourth years, I think it is a good idea to make a separate WhatsApp group for each subject. Because I had that idea in my third year, and what I did was I had a separate WhatsApp group for each 19 subjects, and I was the only member in those groups. So I used to collect any random information in that particular group. So I would take a screenshot of any grading system or any scoring system, or any potential MCQ that I found, or any image. So I think I had a good collection of images and screenshots towards the end of my preparation. So that actually helps you to cover those topics which you won't find in your regular books. And I think for preparing for an exam like INI-CET, where they can ask you some random stuff from time to time, it is quite a good resource that over a period of time you collect such a good inventory of questions and random MCQs that um, it gives you an extra edge in terms of preparation. Apart from the other traditional sources that you read, if you do this earlier from the early part itself, it really is a good technique to cover the extra bases that can be asked. So I think that would be a good idea to do that if you are in the early part of your MBBS. And if you are towards the later part of your MBBS on in internship, and if you are preparing for NEET PG which is going to happen in March, I think the best way to do it would be to just focus on your weak topics right now. So I think when you have given a few grand tests, you have an idea about what are the weak topics or what you feel uncomfortable with. So it is a very good idea to just focus on those topics more and more, because topics like surgery and medicine, I think if you are good in them, then you won't need to revise many times. But topics like forensic medicine or microbiology or pharmacology, which are highly volatile, I think it is a very good idea to revise them more and more towards the end of your preparation, because the more nearer to the exam you revise those topics, the more benefit it will happen on the actual exam day. So that is how I prepared. I used to grade my topics in terms of volatility and prepare the most volatile towards the end, and that really helped me to retain the facts in the actual examination.
great. I think to a large extent, the credit should go to your classmates also. They motivated you to do, I think, much better. Stiff competition this time, I think. More than
Definitely,
15 in the top 100 aims,
definitely.
Onions.
Yeah.
Fantastic. Right. Huge congratulations to you. Best
Thank you, sir.
wishes.
Thank you.
Okay. Okay, then. All the best.